Are you someone who suffers from heavy flow during menstruation? Does it hamper your daily life? Makes you so weak that you can't leave your bed? While heavy flow or menorrhagia is common, having flows where you need to change pads every hour and feel nauseous is not normal. Painful flows or dysmenorrhea is also terrible for your overall health. To put into perspective, average women bleed 3 to 4 tablespoons every menstruation. But women with heavy bleeding can bleed up to 8 tablespoons or more. Symptoms of heavy bleeding are changing your sanitary product every hour or two, passing large clots the size of coins, getting extreme cramps, and staying in bed to deal with the weakness. Unfortunately, some people may go through this every month and become extremely weak. But there are treatment options for painful flows. If your period hampers your daily life, it's time to see a gynecologist. You need to do a checkup and need to find a treatment for it. Severe bleeding causes enormous pain while peeing and having intercourse. It can also lead to anemia. They could also be indicators of bigger disease such as endometriosis, PCOS, tumors, inflammatory diseases in the pelvis, and in some cases, womb cancer. You might need to do a blood test for the diagnosis. Having too much estrogen or hypothyroidism can cause severe flow. For painful and heavy bleedings, gynecologists usually suggest birth control pills, medicine that decreases bleeding and inflammation. Painkillers are a common solution for painful cramps. Surgery to remove fibroids or the uterus is a viable option as well. If you are pregnant and you get painful cramps with heavy bleeding, you need to go to the hospital immediately. This is a sign of miscarriage. It could also mean ectopic pregnancy that is life-threatening for the mother. There is a social stigma that women must endure any pain that comes their way. Don't tolerate heavy bleeding, something that affects your body because of outdated stigmas. Seek out help. With proper treatment, heavy and painful periods can become manageable. And most importantly, before you take any treatments or medication for heavy and painful periods, consult a doctor beforehand. Taking medication without a prescription can lead to further issues. That's today's period talk. See you on the next video. Meanwhile, download the Chondo app from Play Store or App Store and bleed with pride.